Hey, ladies and gentlemen, and now we're going to be talking about the word gastritis. So now we're up to 156 vocabulary lesson. And now, gastritis is this here. See now, that's the part of the stomach inside of the man's stomach. So the gastritis, which is so a gastritis is a general term for a group of conditions with one thing in common: inflammation of the lining of the stomach. The inflammation of gastritis is most often the result of infection with the same bacterium that causes most stomach ulcers, or the irregular use of certain pain relievers. Drinking too much alcohol also can contribute to gastritis. And so now, so in here, so gastritis is also called a stomach inflammation. So a gastritis is a stomach inflammation. So that's what it is, folks. Okay, it is. All right. So now, inflamed. It has this inflamed stomach lining. It has this here, the inflamed stomach lining right here. See, inside here. Okay, that's what it has. Any of a group of conditions in which the stomach lining is inflamed. Causes include infection, injury, regular use of pain pills called NSAIDs, and too much alcohol. So that's what it is, folks. Okay. So now I'm going to read out this whole information page right over here. So a gastritis may occur suddenly, acute gastritis, or appear slowly over time. Chronic gastritis. In some cases, gastritis can lead to ulcers and can increase risk of stomach cancer. For most people, however, gastritis isn't serious and improves quickly with treatment. The signs and symptoms of gastritis include gnawing or burning ache or pain, indigestion in your upper abdomen that may become either worse or better with eating, nausea, vomiting, a feeling of fullness in your upper abdomen after eating. Gastritis doesn't always cause signs and symptoms. When to see a doctor. Nearly everyone has had a bout of indigestion and stomach irritation. Most cases of indigestion are short-lived and don't require medical care. See your healthcare provider if you have signs and symptoms of gastritis for a week or longer. When to see a doctor. Nearly everyone has had a bout of indigestion and stomach irritation. Most cases of indigestion are short-lived and don't require medical care. See your healthcare provider if you have signs and symptoms of gastritis for a week or longer. Seek medical attention immediately if you have severe pain, if you have vomiting where you cannot hold any food down, or if you feel lightheaded or dizzy. Tell your doctor if your stomach discomfort occurs after taking prescription or over-the-counter drugs, especially aspirin or other pain relievers. If you are vomiting blood, have blood in your stools, or have stools that appear black, see your doctor right away to determine the cause. The causes. Gastritis is an inflammation of the stomach lining, weaknesses, or injury to the mucus-lined barrier that protects the stomach wall, allows digestive juices to damage and inflame the stomach lining. A number of diseases and conditions can increase the risk of gastritis, including inflammatory conditions such as Crohn's disease. What is gastritis? A gastritis is when your stomach lining gets red and swollen, inflamed. Your stomach lining is strong. In most cases, acid does not hurt it, but it can get inflamed and irritated if you drink too much alcohol, have damage from pain relievers called NSAIDs, or smoke. What causes gastritis? Gastritis may be caused by many things. It can be caused by diet and lifestyle habits such as drinking too much alcohol, smoking, extreme stress. This can be from serious or life-threatening health problems. Long-term use of aspirin and over-the-counter pain and fever medicines. Health issues that can lead to gastritis include infections caused by bacteria and viruses, major surgery, traumatic injury or burns. So this is what a gastritis right here will look like here. See? This is the that's how the whole picture of the gastritis is right here. So a gastritis. And what is gastritis? Gastritis is a term commonly used by the public and sometimes by doctors to describe episodes of stomach discomfort, usually after eating, sometimes associated with nausea and or vomiting. We refer also to upset stomach or indigestion. However, strictly speaking, gastritis is a formal medical term for a diagnosis made by a pathologist when evidence of inflammation and damage to the stomach lining is seen in a biopsy specimen taken during an upper endoscopy. And it may sound odd to say, but in the true use of the term, gastritis, at least the chronic type, see below, usually does not cause episodes of indigestion. And there are two types of gastritis, acute and chronic. All right, folks. Oh, here it is right here. I'm going to read it to you. He was initially diagnosed with vertigo and gastritis. Gastritis is another cause of bleeding from the stomach. That's what it is, folks. Alcohol consumption can irritate the stomach lining, leading to gastritis. Although the word gastritis is sometimes used as a synonym for upset stomach or indigestion, it most accurately refers to the evidence of inflammatory cells in a stomach biopsy, usually obtained through an upper endoscopy. All right, that's it, folks. The lesson is over. Hope you guys enjoy the lesson.